My name is Michaela Santoro, and I'm going to be performing my physical assessment. Okay. Before I even start throughout my entire assessment, I'm going to be looking at the patient head to toe for their skin, for temperature, lesions, wounds, edema, hair distribution, basically any abnormalities. I'm going to be continuously noting as I go through. I'm going to introduce myself to the patient. Hi, my name is Michaela. I'm going to be your student nurse today performing your physical assessment. What's your name and your date of birth?
Melissa Torres, 12/31/94.
Great, and I'm checking that with your wristband as you're saying that. They both check out. And do you currently know where you are today?
Yes, I'm in Worcester.
Yes, and you know what the date is?
It's Sunday.
Yes, it is. And why are we here today?
I'm here to do my physical assessment.
Yes. Okay, perfect. So patients alert and oriented times 4. And I want to provide you both privacy and warmth for this assessment. So what I'm going to do is I'm going to give you a hospital gown. I'm also going to make sure, is it a right temperature in here for you, nice and warm?
Yes.
Okay. So I'm going to give you privacy. I'm going to leave as you change the gown. Okay, cool. I come back. And before we start the assessment, do you have to use the bathroom at all?
No.
Okay, perfect. And I'm going to gather all of my equipment before we start. I have my stethoscope. I also have my pen light. But that's pretty much it. So, first, what I'd like to do is just by looking at my patient, I can already tell that she doesn't have any bad body odor. Talking to her, she's making good eye contact, which is good. And she's got good posture. Throughout my entire assessment, I'm going to maintain my posture and maintain proper body mechanics. So what I'd like to do is explain to you how the head to toe assessment works. Basically, I'm going to be inspecting you, which is just looking you over visually. I may be palpating you, which means just like a light touch. I may percuss in specific spots, which is basically just using my hand to test certain parts of your body. Or I will auscultate, which is listening on my stethoscope. Throughout the entire assessment, if you're feeling any discomfort or if you have any questions, just let me know. Okay. So first what I'm going to do is I'm going to perform hand hygiene. I'm going to put on my gloves because I'm going to inspect your head. So before I even palpate your head, I'm going to note the fact that you have wavy hair, you have brown hair, and it's up in a nice ponytail. So I'm going to palpate, and again, while I'm doing this, I'm looking for any moles, bumps, bruises, lesions, legs, anything like that, parting the hair. I'm not noting any abnormalities. Have you noticed anything wrong with your hair on your own?
No.
Okay. And no excessive dry patches, no nothing lately for you? No. Okay. Next what I'm going to do is I'm going to check your temporal pulses. Perfect, they're both present, which is good. Next what I'm going to do is discard my gloves because I just touched your hair. I'm going to perform hand hygiene. So just first looking at you, I can see that your eyebrows are both there. There's no hair missing. Your eyelashes are both there and you have good, your eyes are both located directly in the same spot in your head, which is good. Next what I'm going to do is I'm going to use light pressure just to check out your sinuses, okay? So this is your frontal sinus. Does this hurt? Nope. Okay, and this is your maxillary sinuses. And does this hurt? Nope. Okay, perfect. While I'm right here, I'm going to just go like this to your jaw, and I just want you to open and close it, like Crapidus. Perfect. And that doesn't hurt when you do that? Perfect. And you haven't noticed any problems with your jaw eating or anything like that?
No.
Okay. So next I'm going to go check out each one of your ears. So just by looking at it, I don't see any dryness, moles, anything like that. There's no excessive drainage coming on. I don't see anything behind your ear, and none of this hurts as I'm touching you. Okay, perfect. There's no excessive dryness. I'm going to do the same thing on the other side again. I'm going to pull it back and down, and I don't see any excessive drainage. It doesn't hurt when I'm pulling on this, and I don't see any moles or excessive dryness. And you haven't had any troubles with your ears recently. Okay, perfect. There's no built up wax, which is good. I'm just inspecting your nose. I see that not only is it straight, I don't see any lesions, no excessive drainage. Your nostrils look good and normal, and you have a nice nose. So now I'm looking at your mouth. Just by looking at it at first glance, your lips are not excessively dry, which is good. I'm going to have you open your mouth. I'm looking at the mucosal lining of your mouth. I'm seeing your hard palate's good, and say ah. Perfect. Your uvula is midline, and your tonsils don't look swollen. So now what I'm going to do is move forward onto your lymph nodes. So what I'm going to do is I'm going to just lightly palpate on both sides of your neck to just check those out to see if they're swollen, okay? So this is your preauricular. This is your postauricular. This is your deep cloud, your deep something. I'll go back to that. This is your super. This is your infraclavicular. This is your infraclavicular, and this is your supraclavicular, and this is your submandible. This is your submental, and right here I'm looking at your trachea. Can you swallow? And you haven't had any trouble swallowing at all? Okay, and I'm going to put light pressure as you swallow. Okay, perfect. Your cartilage did move, and it doesn't feel like your thyroid is enlarged at all. While I'm also in this part of the area, I'm going to assess the carotid pulses. So what I'm going to do is first I'm just going to feel for them one at a time. Okay. Okay, perfect. So both carotid pulses are present, and now what I want to do is assess the carotid pulses for bruise. So first I'm going to make sure that it's on my bell side. Okay, perfect. So what I'm going to do is I'm just going to have you look that way, and I'm just going to have you hold your breath. Okay, perfect. And you can breathe. And on this side again, hold your breath. Okay, perfect. There's no bruise noted, which is good. So now what I'm going to do is I'm going to, moving down the line, I just want to mention the landmarks of the body. So this right here is your sternal notch. Oh, good find. Sternal notch, and then there's your manubrium. And this right here is your angle of Louis. This is the body of your sternum. And this right here is your xiphoid process. As far as the quadrants of your body goes, this would be your lateral. This right here is your mid-axillary. This is your mid-clavicular. And posteriorly, this is your mid-scapula. This right here is your mid-sternal. And on the back side, this would be your vertebral. And the posterior side, that would be the vertebral. So moving forward with the landmarks of the body, I want to go through with your heart landmarks. So this right here is where your aortic is, which is the second intercostal on your right side of your sternum. Moving over to the second intercostal of your left side, that's your pulmonic, also S2, also, yeah, your S2. So then moving down one intercostal, that's where your Erb's point is on your left sternal border. And then moving down one more, this is tricuspid, which is your left sternal border, and then mid-clavicular line on your fifth intercostal is right where you're going to get the maximal point of impulse, which is going to be your mitral valve, also S1. There. So next what we're going to do is listen to your lung sounds. So we're going to do, so this part, there's a lot of breathing in and no breathing out. So if at all you feel as though it's too much, tell me to stop and we can stop. When I say in, just take a deep breath in and a deep breath out. Okay, so I'm going to start on the right, just above the clavicular side. I'm going to move down one intercostal at a time, moving in a lateral motion on this side. So I'm going to make sure that I switch back to my diaphragm. Check. So I'm going to have you take a deep breath in. 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 And I'll start again. Okay, perfect. And now I'm going to do the same thing on the back side, but I want to show the camera, so if you could just turn this way. Thank you. Yeah, sure, sounds good. So I'm going to do the same thing, ladder pattern. I'm going to start up here. I'm going to go 4 down, and I'm going to go all the way down to 7 where I can do the diamond pattern. Every time that you hear me say in, just take a deep breath in. Just like in the front, if you feel as though it's too hard for you, you need to take a break, just let me know. Okay, so in, 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 in. Okay, in, 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 in. Okay, in again, in, and in. Okay, so your lung sounds are present in all fields. Present, good, bilaterally strong. What I'm also going to do is, like I mentioned before, I'm going to percuss just your lower back right here. Just let me know if this hurts. Does that hurt? Does that hurt? Does that hurt? Does that hurt? Okay. And while I'm right here, I just want to mention a couple parts of your spine. This right here is where your C7 is. This right here is where your T10 is. So what I want to do also is I just want to check your expansion of your lungs. If you could go ahead and just take a deep breath in. Perfect. So my thumbs separated so that I know you had really good expansion. What I want to do is make sure that your breathing is good and there's no crepitus going on. So I just want you to take some deep breaths while I just feel for your expanding of your chest, okay? So go ahead and take a deep breath in, 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 and in. Okay. I'm gonna do that again. I want you to say 99 every time I say to do so. Okay, go ahead.
99.
Yep.
99.
Okay.
99.
Okay.
99.
Perfect. And if you could go ahead and face forward again. Perfect. And I'm going to do the same thing as before. I'm going to have you take deep breaths in as I can check your expansion. I'm also going to have you do that again. We'll say 99, just like the back side. So go ahead. Okay, and again, just like before with the 99.
99.
Yep.
99.
Yep.
99.
Yep.
99.
Perfect. I didn't feel any crepitus, anything that shouldn't have been felt. So your breathing is good. What I want to do before I have you lay down for the rest of your exam, I'd like to just test a couple of other things. First, I want to check your pulses, just to make sure that they're present. My vital signs have already been done. Can I, okay. Okay. Okay, so first I'm going to feel for your brachial pulses. Okay, so they're both present bilaterally, and they both have a +2, which is good and normal. Then I'm going to check your radial pulses. Again, both present and +2, which is normal. So what I'm going to do is I'm going to have you can put your sleeves down. Perfect. So now I'm going to have you stand up. Okay, and I'm going to have you walk away from me just a couple steps. Okay, and then walk towards me. Perfect. You have very good gait. So now what I'm going to do is I'm going to have my arms out like this. I'm going to have you face the camera. Okay, I'm noting that you don't have any kyphosis or lordosis. I'm also noting that you don't have any barrel chest and that your diameter is a 2-to-1 ratio, which is correct, which is good. You can go ahead and have a seat. Oh wait, no, you can't sit down yet. I'm sorry. Can you face the wall? And can you touch your toes, please? I'm doing this test to see if you have scoliosis, and you don't. You have a nice straight line, and your vertical line is present. Thank you. Go ahead and have a seat. Okay, so done your heart sounds, done your lung sounds, everything. I'm gonna have you have a seat with your head facing this way and your feet up here. Have a lay down, actually have a seat. Perfect. So first what I'm gonna do is I'm gonna check for JVD. In order to check for JVD, I'm gonna have you look to one side, and I'm gonna see if you have any extension or distension right there, and you don't. And I'm going to have you do the other side. Again, you don't. Perfect. So first what I'm going to do is I want to move on to your abdominal quadrants. First what I'm going to do is get down to eye level, and I'm going to make sure that there's no pulsating masses or anything that's not contour or symmetrical. You don't have anything pulsing that shouldn't be pulsing, so you're looking good there. That's inspection. So next what I'm going to do is I'm going to auscultate. I'm going to go in all 4 quadrants, and what I'm going to do is I'm going to be just giving light pressure and listening to your bowel sounds for no more than 5 minutes in each side, in each quadrant. And before I even begin, I can see that the umbilicus is midline, which is good. So while I'm auscultating, first, diaphragm is 8. Okay, your right lower quadrant. Okay, bowel sounds present. Your right upper. Okay, bowel sounds present. Left upper. Bowel sounds present. And your left lower. Bowel sounds present. So again, now I'm going to do is palpate. So I'm going to start in your right lower quadrant just like I did with listening. And I'm going to be feeling for, in the right lower quadrant, I'm going to be feeling for your right fallopian tube, your right ovary, and if you're a male, or right spermatic cord. I'm also going to be feeling for your your right kidney ureter, as well as your cecum. And next I'm going to go into your right upper quadrant, and your right upper quadrant I'm going to be feeling for your liver, your gallbladder, the head of the pancreas, as well as your flexure of your hepatic flexure of your colon. Next I'm going to be moving over to your left upper quadrant, and your left upper quadrant is your body of your pancreas, your right kidney, and your right adrenal, your left kidney and your left adrenal gland. Just like in this quadrant, there's also a right kidney and a right adrenal gland. So on the left side, you also have the splenic part of the colon, because there's also a spleen in this quadrant. Next, you're going to go down into your left lower quadrant, and here is going to be your left ureter, your left fallopian tube, your left ovary, and if you're male, your left spermatic cord. They are, you also have your sigmoid colon is in this quadrant as well. Throughout all of your abdomen, I didn't feel anything that's distended, weird, not supposed to be there. And I'm noting the fact that your urinary bladder is midline, which is good, not distended, which is good. So yes, this is where I would take your femoral pulses if that was cool, but we're not going to do that. So next what I'm going to do is I'm going to move down to your legs. What I want to do is the range of motion with your legs. So I'm going to have you lift up your right leg. I'm going to be supporting your joints while you do it. I'm just going to let go and keep it there. Perfect. Okay, I'm going to have you bend your knee into you. Perfect. And then straighten this out. While I'm doing this, I'm feeling for any DVTs or varicosities. I don't see any varicosities. I don't feel any redness, hotness, or bumps. Have you had any pain with any of your movements lately?
No.
Okay, perfect. And I'm going to have you do the same thing with this leg. Can you lift this leg up? Okay, perfect. I'm going to have you hold it there. Okay, perfect. And I'm going to have you bend it towards you. Okay, and let it go. And drop it. Again, I was feeling for DVTs and varicosities on that side. I felt nothing to note. No masses, warmth, anything like that. I'm also going to feel for the rest of your pulses down here. These are your popliteal. Okay, they're both present. This is your dorsalis pedis. Present and strong. And here's your posterior tibialis. Both bilaterally equal strong. I'm going to have you push against my hands with your feet. Perfect. And pull up your toes towards your head. Perfect. Both of those are noted. Now what I'm going to do is test the range of motion for your arms. I'm going to have you lift up this arm. I'm going to have you hold it. Okay, perfect. I'm going to have you push down against me. Pressure. Okay, perfect. I'm going to have you bend this arm. Then you're going to push against me. Perfect. I'm going to do the same thing on the other side. Now you lift up this arm. Okay, I'm going to have you hold it there. Okay, perfect. Push down against me. Okay, perfect. Now bend your arm like this and push up against me. Perfect. I'm going to have you squeeze both of my hands at the same time. Perfect. Both arms are strengths equal. Good range of motion, which is good. I'm also going to check your capillary reflex, which is good. If you aren't wearing socks, I would do the capillary reflex down here too. Shape of the nails is healthy. And okay, what I'm going to do is I'm going to have you sit up. I just want to ask you a couple more questions. So have you noticed any changes recently in your bowel habits?
No.
Okay. Have you been using any laxatives or stool softeners? Okay. And what about urinating? Have you had any trouble peeing lately?
No.
Have you noticed any discoloration or odors to your urine? Okay. And another thing that I want to include is self-exams. Self-examinations are very important. So because you're a female, we should do is a self-breast exam after every single shower, if not every single day. What you should do is you should first face a mirror, and what you should do is with your arms up, you should just look at your breasts as they are, make sure they don't look abnormal. You should try to express your nipples to see if any discharge comes out, and note anything that changes. When you're lying down in bed, you should lift up one of your arms at a time, feeling your breast starting at the tail of Spence and picking a particular pattern that you like. There are multiple. You go to circle motion, you go in and out. But basically, you just want to be familiar with your anatomy. So if anything changes, you can tell your doctor. If you were a male, I would tell you to very gently. Grab one testicle at a time, rolling it just to make sure that everything is moving like it should. You're going to be feeling for the spermatic cord, and again, just rolling it with a gentle pressure, making sure to note any problems there, any pain, bumps, bruises, or anything like that. So now that we've done most of the exam, I just have to ask you, do you feel as though you're safe at home where you live?
Yes.
Okay. And do you have anybody at home that you can trust?
Yes.
Okay. Do you, what do you do for work?
I work in a hospital.
Okay, what do you do for fun?
I work out.
Okay, there you go. All right, perfect. So everything's looking good. I had trouble with some of your lymph nodes, but you do have them, and nothing was of concern. Do you have any, before the exam, I would have asked if you had any pain, and it was a 0 and 1 to 10. Did not ask that.
No.
No pain, 0 pain, out of 10. Okay, perfect. You had good gait. Everything else is looking healthy. And you did good. That's okay.
Stop it.